A growing number of Americans are turning to medical payment plans or credit cards to pay off medical debt. And you should know there's a big difference between the two. Experts caution that not reading the fine print could cost you. One woman says she tried to sign up for a payment plan and was instead slapped with a bill for a credit card. Susan Campbell is in Arizona digging into the dilemma, so you can avoid the same.
It's an old vintage.
Carrie Morgan is house hunting, getting ready for a move to Texas.
Now with the credit hit, I'm probably postponed a few more months.
To understand that credit hit, we have to go back to January. Carrie went to the ER.
They said it was $700 and something odd dollars. And I said, well, I don't have that. Can I be on a payment plan? They said, sure, let me take a look. They came back with like $30 a month. And I said, okay, perfect. They said, you should get an email.
A couple days later, she got an alert.
I got a hit on my credit saying somebody did a hard look at my credit. And of course I was freaking out, like, what is going on? And come to find out, it was Banner ran my credit and signed me up for a credit card to put the payments on.
Then a credit card showed up in the mail. Carrie says she never asked for this and never signed anything.
Not a thing. I'm infuriated.
On its website, Banner Health touts its relationship with a vendor that offers credit.
We are starting to see them marketed in more and more healthcare settings.
Patricia Kelmar is the healthcare director for the Arizona PIRG Education Fund. She says medical credit cards could be really costly for consumers.
Oftentimes, they have a zero interest introductory rate, is what they call it. But the interest is significantly higher than you would see on a regular credit card. And if you miss a payment or don't pay it off, the full balance, in a certain period of time, the interest is retroactive.
There's another potential problem if you use a medical credit card.
Now you owe the money to a bank, not to the provider. The provider's been fully paid. If you find out that you were misbilled, now the argument is not with your provider anymore. You've lost that ability to fix that error.
Unlike Carrie, a 2023 report by the Consumer Financial Protection Bureau shows patients report being signed up without their consent or knowledge.
Our healthcare professionals should not be marketing financial products to us in the healthcare setting. It's just a bad idea.
Carrie says in her case that unwanted and entirely unexpected credit card dinged her credit score by 16 points.
I was devastated. And then the more I called trying to find out, to talk to somebody, hey, you can't do this. This is illegal. I heard from billing agents, this happens every day.
When we asked if this is a known issue affecting more people than Carrie, a spokesperson emailed us a statement saying Banner Health takes these concerns seriously. As a matter of policy, we do not discuss patient matters publicly.
Shake?
But Carrie told us after we reached out, the hospital wiped out an $814 bill and discounted another bill by 50%. Cure, the company that issued the card, also told us it will reverse that hard inquiry on Carrie's credit.
Look at the trees.
Now she can get back to her house hunt.
Wow, I'm so thankful that she was able to get that reversed.
Oh, that's ridiculous. I was thinking about when they said they were going to credit her money and 50% off. I was like, well, what about her credit score?
Yeah.
Well, for me, it's traditionally, and I know that's about to change, but traditionally medical bills aren't reported on your credit report.
Mm-hmm.
But a credit card sure is.
Right. So that's a back doorway.
That's a back doorway to dinging your credit report for something that's not even supposed to be on there.
Well, I'm still angry.
Right.
I'm just sitting here feeling so angry. And I think it supports the case of you're in an emergency room, get somebody else there as soon as you can. When you're sick or hurt, you're vulnerable. And so having somebody else there, even if they're there just for the paperwork, to prevent you from creating a problem like that one.